Welcome to the Exercise for Chronic Pain video. This video will review how exercise works to reduce pain. We will also discuss aerobic, strengthening, and stretching exercises.
Hello, I am Dr. Kathleen Sluka. I direct the Neurobiology of Pain Laboratory. Chronic pain is a disease that changes how your nerves and brain respond to pain. Pain cells, called neurons, turn on pain. Your brain also has neurons that turn off pain. Normally, there is an even balance between the activity of the neurons that turn on pain and those that turn off pain, so you do not feel pain. When you have chronic pain, this balance changes so that there is now more activity in the cells that turn on pain and less activity in the cells that turn off pain. Our neurons in the brain use chemicals called neurotransmitters to both send the pain signals and to stop the pain signals. When you have chronic pain, your body produces more excitatory chemicals like glutamate that make you feel more pain. At the same time, your body produces less inhibitory chemicals like natural opioids to stop pain. Importantly, these changes in the nervous system are moldable and not permanent. In addition to changes in the brain, chronic pain conditions are oftentimes associated with changes in the immune system. The immune system is our body's defense mechanism to injury and infection. Like the brain, there is normally an even balance between chemicals produced by the immune system that turn on pain and those that turn off pain, so you do not feel pain. In chronic pain conditions, this balance is shifted so that there are now more chemicals produced by the immune system that turn on pain, called inflammatory cytokines, and less chemicals that turn off pain, called anti-inflammatory cytokines. Like the nervous system, the immune system is moldable and changes are not permanent. Exercise reduces pain through multiple mechanisms. It can change how the brain and the immune system respond to pain. In the brain, the increased activity of neurons and chemicals that turn on pain are reduced. At the same time, there is an increased activation of neurons and chemicals that turn off pain. Exercise uses multiple chemicals in the brain, including natural opioids and serotonin. In addition, exercise also changes the immune system. Exercise decreases pain-producing chemicals, the inflammatory cytokines, and increases pain-relieving chemicals, anti-inflammatory cytokines. These anti-inflammatory cytokines also promote tissue healing. Thus, exercise works to normalize processing of pain signals in the brain and the immune system, promote release of chemicals in our body that turn off pain, and heal injured tissues. So clinical studies in people with chronic pain show both aerobic and strengthening exercises reduce pain and fatigue and improve function, which allows you to do more activities you enjoy.
Hello, I'm Dr. Dana Daly, a clinical expert in the treatment of chronic pain and faculty member at the University of Iowa and St. Ambrose University. People with a chronic pain condition especially need exercise and increased activity because they need to provide their body and brain with the signals needed to adapt and get better. People with chronic pain often feel anxious about exercise being uncomfortable. They worry about not having time, think they will not meet their goals successfully, or doubt that exercise will help them. We understand this. This is entirely normal, and in fact, almost everyone who exercises successfully feels or thinks this way at one time or another. Regular exercise helps your body become stronger so you can do more activities you enjoy. Exercise can help you stay engaged with your family and community, resulting in a happier, healthier, and more productive life. The best exercise is one that you enjoy doing. It's most important to increase your activity more than you're currently doing. You can start with as little as 5 to 10 minutes per day and increase that amount towards a goal of reaching 30 minutes or more per day. We recommend exercising at a moderate intensity for best effects. Group-based exercise classes can be fun. These can be yoga, tai chi, walking clubs, or dance classes. The most important thing to do is to remain active and keep moving. There are a number of different ways you can do aerobic exercise. Choosing the activity you enjoy is very important to your success. Some examples of aerobic activity include walking, biking, or swimming. It can be any activity that elevates your heart rate and breathing rate while you're doing it. You can also increase your physical activity by doing things like taking the stairs, parking a bit farther away from the store, walking instead of taking a ride when possible, and doing lawn or housework. To check if you're at a moderate intensity, use a 0 to 10 scale for effort. 0 is no effort and 10 is maximum effort. Moderate intensity on the effort scale is between 3 and 6. With chronic pain, each day can be different, and some days you may be able to exercise at a 3 and other days at a 6 on the effort scale. The only difference between a 3 and a 6 is how many calories you burn. Another way to check your effort is to do what we call a talk test for breathing. So you should be able to talk while exercising, but not sing. To begin a strengthening program, we recommend you complete 3 sets of 10 repetitions. You should do the same strengthening exercise a minimum of 2 times per week. If you aren't able to do 3 sets of 10, begin with the number of repetitions you can do and gradually increase the repetitions each week until you're able to do 3 sets of 10. To begin a stretching program, you want to have a feeling of mild stretching without pain in the muscle you're stretching. You should hold the stretch for 30 seconds. Each stretch is done 3 times. If you're unable to hold the stretch for 30 seconds due to pain or shaking of your muscles, you're stretching too hard. Reduce the amount of stretch to the muscle. Stretching should feel good while you're doing it, and you should feel more mobile when you're finished. We have reviewed the mechanisms and types of exercise for reduction of chronic pain. We have exercise handouts for several common areas of pain. You can use the exercise handouts and/or a demonstration video of the exercises. Please see your primary care provider or physical therapist if you have further questions.